Have you thought about what you will do if or when Alzheimer's knocks at your door? Millions of Americans are challenged by caring for Alzheimer's patients. This dreaded disease afflicts more than 5 million Americans. 1 in 10 Americans 65 years of age and older, and almost half of all Americans 85 and older. And those numbers are only expected to triple by the year 2050. Here with what your family needs to know is nationally renowned Alzheimer's expert Dr. Gustava Alva and Betsy Arnold, who knows firsthand how Alzheimer's can affect a family. Good morning to both of you.
Good morning.
Good morning.
So it's pretty scary when you look and hear the number of people being affected by Alzheimer's and the number of people actually being diagnosed with Alzheimer's. What is your message this morning? Betsy, let's start with you. I know you have a personal experience and know firsthand this morning about Alzheimer's.
I think the most important thing that I learned in our experience is that your attitude is your greatest asset. You know, you have to walk into this disease with a positive attitude. We always looked at taking care of my mother as a privilege rather than a duty. The second most important thing is you have to know your opponent. You know, you have to prepare yourself. You have to educate yourself on this disease so you understand what's coming, because we had no idea what was going on when we were taking care of my mother. So that's why we wrote the book, you know, to help people understand what it is that they are getting ready to go through.
Doctor, I would imagine that you would agree with what she just said as well from a medical perspective. It is pretty scary when you look at the amount of people affected by this disease, and we still don't know a cause for this, do we? A cause for Alzheimer's?
We certainly don't. We don't know the exact underpinnings behind the illness. We know that the biggest risk factor for developing Alzheimer's disease is getting older, but there's also a genetic interplay that's very important. There are certain modifiable risk factors like hypertension, diabetes, obesity that we can obviously have an impact upon. But the reality, like you said, we don't know exactly why it actually occurs. We just note that there's a correlation with age. So people over the age of 65, if they suspect that there's a memory problem in themselves or a loved one, seeking out one's own doctor would be a very good first step.
It's interesting. I've had 2 grandfathers that have passed away from Alzheimer's. Is there anything that we can do at a younger age to see if there's any genetic ties to it, or is there any way to help prevent Alzheimer's by doing certain things? I would hope.
You know, that's a terrific question that I oftentimes get asked by family members. There is nothing that's protective per se against the development of the problem. The only protective factor that we know of is having a higher occupational or a higher educational backdrop, which speaks towards the aspect of cognitive reserve. If you don't use it, you lose it. And in essence, if you use more, then obviously there's more to play with. I would also couch the aspect that in family members with a loved one that's developed Alzheimer's disease, if they're really concerned, learning a new language is a terrific thing to do. What's the downside? You'll become a polyglot, maybe become more interesting in discussions. Learning a musical instrument. So utilizing different parts of our brain that we've not necessarily used, and keeping in mind that what's healthy for your heart is generally healthy for your brain, which means good nutrition, physical and mental activity are key and primordial to keep in mind.
Okay. Well, and Betsy, I love that you talked about that it wasn't a duty taking care of your mother. It was a privilege. And I know that it can be very, very taxing on the family, especially seeing it in my own family. What is your advice? What's your take home here this morning on how to caretakers can take this head on? Again, with that positive attitude, I think.
Well, I think, again, you know, your attitude is your greatest asset, and that you're not alone. There are millions of people out there who are dealing with the same issues that you are, so you've got to educate yourself and learn about the disease. And I think those are 2 of the most important things. And get a good doctor, you know, a doctor that you trust and that can help you and advise you, you know, advise you through the steps and the different medicines and the different things that you can do. So it's just important to educate yourself. Educate.
What about support groups?
Support groups are great.
Yeah.
I mean, if you've got one in your area, absolutely. You need to go to a support group.
All right, well, as we close here, any one particular website you want to send us to get more information? I know you have the book.
ALZ.org has great information on the disease state itself. Betsy's website has...
We're at caregiversunited.com. is our website, and that's where you can also purchase our book that will help you understand and give you practical tips on the disease.
All right. Well, thank you so much for doing that. Thank you both so much for taking some time to chat with us this morning. We appreciate it.
Thank you.
Thank you.
All right. And of course, we will put all that info on our website as well, foxformorningblend.com. Up next, a way to look and feel better about yourself without turning to surgery.